As a principal at Milliman, I work primarily with providers and payers who are trying to develop and implement specialist payment arrangements like episode-based payments or other novel forms of contracting. TEAM stands for Transforming Episode Accountability Model. It is a payment model that has been rolled out by the Centers for Medicare and Medicaid Services to hold hospitals financially accountable, not just for the services they provide, but also for services 30 days after the patient leaves the hospital. TEAM goes into effect January 1st, 2026, but there are lots of ways that providers are preparing now because the model has substantial potential financial implications. CMS has run several different episode payment models over the years. Some have been voluntary and some have been mandatory. In this case, TEAM is an expansion of a mandatory model, so they've made it mandatory so that they can really test the effectiveness of the model in a lot of different areas, including in hospitals that really don't want to do it and haven't experienced episode-based payment before. The first challenge that hospitals will be facing in order to comply with TEAM is really understanding the full spectrum of care that patients are receiving. Right now, hospitals can see what happens within their walls, and they might know quite a bit about the physicians practicing in that hospital, but they don't necessarily have any view into what's happening after those patients leave the hospital. One thing hospitals will have to think about is how to identify patients early. They are required to notify patients that they're part of the model, and they also have reasons that they will right away want to make sure that patients are in the right care pathway to meet TEAM's requirements and to meet their financial goals for the program. Hospitals will also be concerned about working with the clinicians within their walls to achieve those goals. Building some clinical momentum behind this program is important in hospitals being able to motivate change. Implementing a CMS payment model is really complicated. It requires stakeholders from across the enterprise within your hospital or health system. I think the biggest mistake we see is people taking a wait-and-see approach. Because these programs are usually retrospective, by the time you learn if you've saved or lost money, it's too late to make a change, and you're 2 years behind now. If managed well, hospitals and health systems can improve not just their finances, but also patient outcomes through the TEAM model. The model is built to incentivize care pathway improvement, making sure that transitions are seamless for patients from a hospital to the post-acute facility or to their home. The TEAM model also incentivizes reductions in readmissions or complications, and hospitals will be measured and paid based on those outcome metrics, which will benefit patients. From a hospital standpoint, success in TEAM means that I'm treating patients better and managing cost at the same time. I'm creating partnerships with other providers and making sure that patients receive the best care in the most efficient way. From CMS's perspective, they also care about beneficiary outcomes in this program, and they are explicitly paying for them. They are doing that through financial accountability at the hospital level. So in that way, hospital and CMS success in the program is similar. Very often, hospitals don't have a view into what's happening outside of their walls. For TEAM, having that view is essential. So data and analytics can help you understand not just what your hospital is doing, but also what the post-acute facilities in your region are doing, which will impact your TEAM success. Furthermore, data and analytics can help you understand the performance of peer institutions. If other hospitals in your region are far ahead of you in terms of their care transformation, that may have a detrimental impact on your finances as a hospital in that region. For a participant in TEAM to really succeed in the program, they need to understand the full episode that their patients are receiving, and that includes hospital services, but also post-acute services. Without understanding that, there's no way to impact the trajectory of those patients going forward. Milliman has developed MedInsight Bundles as a way to meet a market need for data and analytics to support TEAM participants. Without having a clear view of the full claims-based trajectory of a patient, you can't impact that trajectory. So the MedInsight Bundles tool helps hospitals understand their own experience, what historical patients would have looked like under Team, as well as how that experience compares to their peers so that they can identify opportunities and set goals for improvement. Milliman MedInsight sets itself apart in this area because of the combination of our analytic expertise and technological infrastructure. For decades, we've been working with providers and payers who are in these types of arrangements, so we really understand the risk they're taking and how to manage it, and we've coupled that with the strong technology base of MedInsight to create the MedInsight Bundles tool. The Milliman MedInsight Bundles solution will allow hospitals to reduce the amount of unknown in their Team implementation. They can start now to understand care patterns and care pathways and to implement clinical transformation on the ground. We had a client who recently used the Milliman MedInsight Bundles tool to identify high-cost cases within their hospital and drill into what was driving that cost. They were able to quickly identify that one of their physicians had started using an expensive wound care management system that was not clinically necessary for all of the patients who were receiving it. By intervening early and changing that clinician's care pattern, using the data to demonstrate the difference, they were able to save thousands of dollars per patient moving forward. Hospitals can't change processes overnight, and Team is coming fast. So the Milliman MedInsight Bundles product can help accelerate your hospital to the information you need to succeed under Team. The Milliman MedInsight Bundles tool can help hospitals identify quick action steps they can take to support Team success.